CBC's Megan Fitzpatrick is at the Ontario Legislature in Toronto. She joins us now live. So Megan, take us through the changes to COVID-19 measures that Dr. Moore announced today.
There's a lot of them, Arthi, but one of the key ones is the lifting of mask mandates on March 21st for most indoor public settings, and that includes in schools. It won't change, however, for wearing masks on public transit, in hospitals and healthcare settings, long-term care homes, and other higher-risk congregate settings. Those mask rules will be lifted later in April. Now, Dr. Kieran Moore is still advising Ontarians who are vulnerable to COVID-19 to keep wearing masks. And anyone who wants to wear one, if that is your comfort level, keep wearing it. But it will no longer be mandatory in these public indoor settings. Another major change is the revoking of mandatory vaccination policies for a number of settings in Ontario. So the Chief Medical Officer had issued what are called letters of instruction and directives to schools and hospitals and other places mandating that they had a vaccination policy that would either require their staff to be vaccinated or to have a medical exemption or to undergo regular COVID-19 testing. Those requirements will be gone over the next couple of weeks, Arthi, but individual workplaces and organizations can continue to have their own vaccination policies, similar to how the vaccine passport was lifted recently in Ontario, but businesses can continue to require proof of vaccination if they choose. Another major change announced by the province today has to do with the rules around isolating. If someone in your household or a close contact has COVID-19. Before, if someone in your household tested positive, then everyone in the household would have to stay home as well and isolate along with them. But that will change. For people that are over 18 and have their booster dose, they will not have to stay home. For those under 18, if they are fully vaccinated, they will not have to stay home and isolate along with that household contact. More restrictions lifting over the next couple of weeks as well. By the end of April, Arthi, April 27th is the date that they pegged. That is when the other mask rules will be lifted, all remaining directives and measures revoked. So quite a bit announced today by the Chief Medical Officer. He's calling this a plan to live with COVID-19 in the long term and to manage it in the long term.
And we certainly heard a lot of questions to the effect of the timing. So how did Dr. Moore explain his decisions and why they were announced now?
Well, he did reiterate that the pandemic isn't over. Just because they're lifting public health measures doesn't mean that COVID is gone. It's still here, it is still circulating, and there's still a risk of it. It's just a lower risk than it was in January, for example, when we were getting hit hard by that Omicron wave. He is saying that the trends are stable right now. Hospitalization rates, for example, still stable, even though restrictions have been lifting, like capacity limits over the last couple of weeks. So he's saying he's confident, he's comfortable with where Ontario is at, that all these public health measures were largely in part designed to protect the health system, and they have done their job, that those strategies have worked. Here's more of Dr. Kieran Moore explaining his decisions.
My decision-making and recommendations to government have not been affected by any understanding of the political system, that they are based on evidence and science, and that we followed a phased and staged approach. I just outlined the dates that we've followed. We've been doing every 2 weeks that we've had phased and staged reopening. It has gone very safely.
And Premier Doug Ford also commenting this morning, Arthi, saying Dr. Moore faced no political pressure for making these decisions. Ford saying he is following the advice of Dr. Kieran Moore, and Moore there saying that his decisions are based on science and evidence, not politics. Bottom line from Dr. Kieran Moore, he said, because the risk is lower, you have to change the public health measures proportionately. And he said in one key line, you can't mandate masking forever. At some point, it does have to become an individual choice. He's telling Ontarians to do their own risk assessments when they leave the house to determine whether they feel like they should wear a mask or not. So the big difference really is that the government won't be mandating it in these places. It will be an individual decision. And he encouraged people to be kind to one another and respect those decisions, Arthi.
All right. Thank you for this, Megan. That is the CBC's Megan Fitzpatrick reporting.